Hello, very good evening to all of you. Today we are going to discuss the case note of Miss Nina Sharman. This is a patient who is in your dementia specific unit. So you are a dementia care nurse there. And because of an episode of accidental choking of food particle, uh, the day before, you are going to write to a dietitian at the Department of Nutrition and Dietetics, Spirit Hospital, Prayer Talk. So, in your letter, explain relevant social and medical histories and request the dietitian to visit and assess Ms. Sharman's following function and nutrition status according urgently due to high-risk aspiration. So what we have to see here, why we are writing the letter. So what we need to include in this letter is to include relevant social and medical histories, which a dietitian should know. So a dietitian should know some of the social histories. So a dietitian should know some of the medical histories because we do have a lot of data here. So we need to find out what exactly we need to include there. And request the dietitian to visit and assess Ms. Sharman's following function and nutrition status urgently. So we are going to request him an urgent visit for Ms. Sharman due to high risk of aspiration. Now, let's go further with the question, lengthy question. Now, we have the patient's name, and today's date is 21st of March, 2012. So, Nina Sharman, 1951 is her date of birth, 9th of February. Now, she's a new resident of dementia specific unit. So that's something important because she has not adjusted with this thing. So she's a new resident and she's single. Now, under the Australian Guardianship and Administration Council protection, it's an optional data whether you can include or not. Now, we have some sorts of lifestyle diseases which you have to include is in the medical history. One is IHD, that is ischemic heart disease. Another thing is diabetes mellitus. You can see here in the medical history, diabetes mellitus is ischemic heart disease. So these things have to be written. So as she is a patient in the dementia care unit, so you have to say that she is having severe dementia and is unable to follow some instructions, confusions, disorientations, all these things are there for her. Now, I told you that you need to include diabetes mellitus and the diet is also there, diabetic diet. So we don't have anything to do with osteoarthritis, no allergies to medication. But we need to include something else. We need to include the weight gain because that's something related to the nutritional status. If you could say the current weight too. And something which is very important is that refuses to wear dentures due to confusion and disorientation. So this is something important there. So she has dentures and she refuses to wear it because of confusions and disorientation. This is very important there. Now we have something else which is important that's regarding the appetite that she has. We just need to say that she has increased appetite. So we don't need to say what type of food she eats and how she eats and all. Now, social history, we do have to say that, see here, no friends, lack of interest, but likes to coloring in. So increased dependence on nursing staff, non-smoker, no use of alcohol or legal drugs, watching TV. So you can say that increase emotional dependence on nursing staff as a social history here, if you want to include that. We don't have to include the chest infection, occasional cough, all these things, because those things happened in the previous month and it has no relevance here. So what we have to say is the recent medical history, what exactly is the episode of choking on a piece of food, which was not chewed properly. So that you can see that, so grabbing the throat with both hands and cough, and the piece of solid food was removed. So this was the thing here. What happened yesterday at 5 p.m. So and after 10 minutes, so mm, you know that every no, yeah, after an hour, so you can see that every vital parameters became normal. So we just need to see the things which are relevant to the dietitian. So what we have seen in the case note, we can see dietitian spelling is DIETICIAN. Here I have written TIAN because we no longer use CIAN in international English. So we use DIETITIAN. So dietitian. So there was two spellings before, DIETICIAN was one thing. This was the thing. So this is now recognized universally. So I would recommend you to write the updated spelling here. So you can search into Google and confirm whether the spelling, what the correct spelling of dietitian, whether there was an updation or something like that. You can confirm it in Google now. So, dear dietitian, Miss Nina Sharman, you have seen the date of birth too. So, this letter has been written to request an urgent assessment for Miss Nina Sharman, who is at high risk of aspiration. We have not said anything. We have said that I need you to visit Miss Nina Sharman, who is at high risk of aspiration. So that's it. We have not said something in detail here. Now, we said in the second paragraph, the most recent history, what we have seen here. Ms. Sharman had an episode of choking yesterday, probably because of improper chewing. In a quick response, cough was initiated, which resulted in a successful removal of the swallowed food. She became stable in an hour, as evidenced by normal vital parameters. So what is in the second paragraph is what is the recent history? So what is the recent medical history? What happened to her actually? So the thing happened to her is she had an episode of choking. And this may be because of improper chewing. We have not confirmed it. Maybe some other reflexes, maybe some other problems, maybe due to confusion, maybe, we don't know. So that needs to be assessed. So in a quick response, we have connected it with the first sentence. In a quick response, cough was initiated. So we have written in passive voice. So cough was initiated, which resulted in the successful removal of swallowed food. So how the food came out? It's not because of grabbing the throats actually, because of the cough reflex, only the swallowed food came out. So that's what we have written there. Now, what is her condition? What was her condition? What was the outcome? She became stable in an hour, as evidenced by normal vital parameters. So what is this? Is the recent medical picture, which a dietitian should know. So that's why we are writing to the dietitian for an urgent assessment. Ms. Sharman is a new resident at our unit. So this is something which I told you, it's a highlight there. So she is in dementia-specific unit and she is a new resident. And she has been diabetic since 2000, and therefore she is on diabetic diet. So something related to the medical history and something related to her diet. In addition, she has increased appetite and has gained 10 kg over the past 5 months. So we have not said the weight here, the current weight here. So we have said the intensity of the weight gain. So instead of telling her BMI and weight, you can include the BMI and weight if you need to focus. But I focused on the weight gain, how much is the weight gain. So that's the real focus there instead of BMI and the current weight. You can add that too if you have the space. Apart from these two issues, she has chronic constipation for which she's on laxatives. So this is something related to a dietitian. So nutritional status, so dietary and nutritional status. So because of some food, she may have chronic constipation. So we need to make some alterations in the food habits or the type of food so that she may not need laxatives. So she also has a history of dementia and ischemic heart disease and is often confused, disoriented, and forgetting to wear her dentures. Now, she has dementia. She has ischemic heart disease too. She has a history of dementia and ischemic heart disease. So this is, we have written diabetes, we have written constipation, we have written dementia, we have written ischemic heart disease. And now we have written something else at last, that's confusion, disorientation, and forgetting to wear her dentures. So instead of forgetting, I can say refusing, and because it is clearly said refusing. Now, that's the remote history, social history, and medical history. Now, it would be highly appreciated if you could visit Ms. Sharman at the earliest. It means an emergency visit. Assess her swallowing function as well as her nutritional status in order to prevent any further complications. So this is what we have. What is the purpose? So it be highly appreciated because your visit is highly appreciated because it's an urgent visit. She needs you as fast as possible. So I have written highly appreciated instead of just appreciated. It would be highly appreciated if you could visit Ms. Sharman at the earliest, assess her swallowing function, as well as her nutritional status in order to prevent any further complications. That's it. Now, in case of any further queries regarding Ms. Sharman's condition, please do not hesitate to contact me. Yours faithfully, registered nurse, dementia specific unit. So we try to include all the relevant data which are relevant to the dietitian in this situation. So still, the letter is not perfect because we could include a lot of things. We could make the letter far better. Hope so. Thank you, and we'll be meeting you with another letter soon. Till then, bye.